Okay, my name's Angela Scott. I'm going to be the nurse today. So first I'm going to start with my 12 safety practices. I'm going to review or verify the patient's order, perform hand hygiene before and after touching any equipment or the patient. I'm going to review the policies and procedures of the facility. I'll look at the manufacturer's recommendations for the equipment. I'm going to knock on the patient's door, identify the patient by two identifiers, explain the procedure to the patient and provide for privacy. I'll note in the patient's overall condition, and I would raise the bed for good body mechanics, don any PPE necessary. Once I've completed the procedure, I would lower the bed, raise the bed rails, and make sure that the safety call light is in reach. And then I would document any abnormalities and report to the physician. So now I'm going to do my 6 rights of medication, since we're going to be administering medication today. I will make sure I have the right patient, the right time, the right dose, the right time, patient, dose, time, medication, right documentation, and right route. So now I'm going to come into the patient's room and introduce myself. I'm going to tie my tourniquet, and I'm going to find my vein. So I'll feel around, find the vein that works for me. And then what I'm going to do, all of this would be working, making sure that I kept a sterile field. And then I'm going to uncap my needle and make sure that the bevel is up and that there's no defects in the needle, so that it's not going to harm the patient. I'm going to clean the area in a circular motion, working my way outwards. Make sure that that's all clean. Then I'm going to go ahead and insert the needle at a 10-degree angle. I'm going to let the patient know that they're going to feel a little sharp twinge, I guess, of pain, but it won't last too long. So I'm going to, at a 10-degree angle, actually I'm going to pull the skin tight. I'm going to insert at a 10-degree angle, and I'm going to insert, and I'm going to look for flashback and make sure when I see that, then I will start to slowly remove that, and I would cap that and put it in the sharps, discard of it in the sharps. So I'm going to remove the tourniquet from the patient, all while holding this in place so it's not moving or disturbing or hurting them. And now I'm going to uncap. I'm going to connect so that I can flush and make sure that everything's going to be okay for the patient. I'm going to flush the tubing and make sure that it's clear. Then I would tape make sure that I hold this in place, and then I would tape so that it's held tightly in place there and not hurting the patient. Make sure that it is, I'm going to disconnect this. I'm going to make sure that it's patent and there's no signs of tenderness, redness, or anything. I've already written on my Tegaderm my initials, the gauge of needle that I used, the date and the time for the next person on the shift to come in. So I would place that down. All right, and I would remove this. If it would come off, I would remove that. And then I'm gonna go and I'm gonna look at my doctor's orders of, I've already initiated, so you'll come in, let them know that I'm gonna initiate the saline lock. I would do that. And then I would give 2 milligrams of morphine via IV push, 1 dose, and I'm gonna do that. I'm gonna push that over 2 minutes of time. And then I would come back, I would check on the patient, check their vitals. After 30 minutes, I would check their vitals and look for any respiratory issues. And then I would, next order, I would come back and I would begin normal saline, 150 milliliters per hour, and I would do that for 8 hours. So I would let the patient know what I was gonna do, and I would set the machine to 150 milliliters per hour for 8 hours, and then I would check on the patient in between those times. And then I would note how the patient handled the procedure, and document anything from that.